How does socioeconomic status affect kidney disease and hypertension? Have you ever wondered how your financial situation can impact your health? Specifically, let's talk about kidney disease and hypertension, also known as high blood pressure. Socioeconomic status plays a significant role in both of these conditions. Understanding this connection can help us see why certain groups are more affected than others. First, let's look at the risk and prevalence. Individuals with lower socioeconomic status often face challenges like lower income, less education, and unstable jobs. These factors contribute to a higher risk of developing hypertension. Since hypertension is a leading cause of chronic kidney disease, this connection is critical. Research shows that people living in economically deprived areas have higher rates of both hypertension and chronic kidney disease compared to those in wealthier neighborhoods. Next, consider the severity and progression of these diseases. People from disadvantaged backgrounds often receive a diagnosis of kidney disease at more advanced stages. This is partly due to delayed diagnosis and limited access to preventive care. As a result, kidney damage from hypertension can worsen before treatment starts. Access to care is another important factor. Those with lower socioeconomic status frequently encounter barriers to quality health care. This includes lack of health insurance, fewer health care providers nearby, and financial constraints. These obstacles can make it difficult for them to manage their blood pressure effectively and slow down the progression of chronic kidney disease. Lifestyle and environmental factors also play a role. Individuals with lower socioeconomic status may have higher rates of smoking, unhealthy diets, and less physical activity. These lifestyle choices can contribute to elevated blood pressure and kidney damage. Additionally, living in poor housing conditions or areas with limited access to healthy food can further impact health. Social determinants of health, such as education and community resources, shape health outcomes as well. These factors influence how individuals manage their hypertension and kidney disease. For instance, those with better health literacy are more likely to stick to their treatment plans and engage with healthcare services. Lastly, we cannot ignore the ethnic and racial disparities that exist. While socioeconomic status affects hypertension and kidney disease independently, it also interacts with racial and ethnic factors. Some minority populations experience higher rates of these conditions, and socioeconomic disadvantages can partly explain this trend. In summary, socioeconomic status significantly impacts kidney disease and hypertension. It increases the risk of developing these conditions, worsens their severity, limits access to care, and influences lifestyle choices. Addressing these socioeconomic factors is essential for improving health outcomes related to hypertension and kidney disease.